All right, welcome everybody. We are going to go ahead and get started with our webinar today. And if you can't hear me, just let me know. You're welcome to ask questions in the chat box, and I'll get to them at the end. So I'm Dr. Kim Harris. I'm a naturopathic doctor, and I'm the owner of Prescott Medical Aesthetics in Prescott, Arizona. And we focus on medical aesthetics, wellness, and we have a couple of naturopathic doctors on staff. We have a medical esthetician, and we do all things beauty and wellness. That's a little bit about me. I am a Prescott native, and we've been open here for about 4 years in Prescott, focusing on medical aesthetics. And the reason I wanted to talk today about sun damage and hyperpigmentation is because it's probably one of the most common complaints that men and women come in with. And pretty much everybody has it, honestly, unless you've been super careful your entire life. Even as a child, you typically will have some sun damage. And so I wanted to cover it for patients and give a little bit more information about what causes it, what we can do to prevent, and how we can treat it. So I just wanted to give generally what causes, what the most common causes of aging and collagen loss are in general. Number one is smoking. So if you're a smoker, we do recommend that you stop. Not only is it really bad for you, but also causes quite a bit of aging and damage to your skin that can be very difficult to repair. Sun exposure and UV rays, which we're going to be diving into a little more deeply today. Genetics also play a role, and there's only so much we can do about genetic factors when it comes to aging, but there's so many wonderful treatments now that can either prevent the signs of genetic aging. Whenever people will come in, they're like, I have these really deep lines in here that my mother had, or have the gels in the neckline that my mother had. Usually we get it from our mother. But there's a lot that we can do to prevent. So if you see that coming in already, just come in, let us do a quick evaluation on you. Sleep habits, that refers to two different topics, really. One, are you getting enough sleep to allow your body to regenerate? And two, how do you sleep? So we do recommend that you sleep on your back if possible. And if not, which I cannot, we recommend that you have a silk pillowcase. And that can really help prevent some of those wrinkling that we get when you lay on your side. Diet is a huge factor. The more pro-oxidative food we have, the more damage our bodies are going to get, and that will show up in your skin. So, making sure that you're eating a whole foods diet, less alcohol, no soda, reduced caffeine intake, and then just increase those antioxidant-rich foods. Green leafy vegetables, especially things like dark-skinned berries, have a lot of antioxidants in them, reducing the amount of meat that we have, just making sure that you're really focused as much as possible on whole foods. And then alcohol and caffeine can also affect the way that our skin looks. And I would put in there water intake as well. Dry skin is a super common issue in this area. And when patients come in and tell me that, and I ask them how much water they drink, and they say, oh, I drink one small bottle of water a day. That's not nearly enough, especially in an arid climate like we live in. All right, so we know that sun causes damage to our skin, right? That's pretty well known at this point. And specifically, we're looking at UV radiation, ultraviolet radiation. And this is the number one environmental cause of different things. And I actually learned this. I didn't know that, dryness can come from sun exposure as well. So what we see when we get too much UV sun exposure, redness, dryness, pigment changes in age spots, definitely. And then, well known is skin cancer. So just a couple of interesting facts that I learned about sun damage when I was doing my research for this presentation. So UV light actually causes changes to your DNA in your skin. And this one kind of blew me away. A single cell can accumulate up to 100,000 changes in DNA in just 1 day of sun exposure. So, if we think, oh, I'm only going to be out for a little while, think about what type of damage we're doing to the skin cells when we're out even for a couple of hours at a time. UV exposure is responsible for up to 80% of the signs of visible aging. The worse the skin looks, the more likely they are to get skin cancer. So even if you're not having visible lesions on your skin that look like they might be cancer, if you have deep wrinkling that shows that you've had sun exposure, you are more likely to have skin cancer at some point in your life. And UVA and UVB are both responsible for aging and cellular changes. So what can we do? Obviously, the number one thing is prevention. So protection of your skin, making sure that you're wearing sunscreen. If you're not wearing sunscreen on a daily basis, you are increasing your likelihood that you're going to get skin cancer at some point in your life. And I'll have these conversations with patients. I don't go outside that much. Well, even if you're walking from your house to your car, from the car to the store, or if you drive, honestly, because you are getting some exposure, even if your windows are rolled up. So I say just stop arguing and start wearing your sunscreen, because you're going to thank me for it in a few years. All right, and when we're looking at sunscreen products, what are the most important factors? So one is the SPF. You want to make sure that you're at 50 SPF. If you're wearing sunscreen or wearing makeup that has sunscreen in it, typically it's not high enough SPF. So make sure you're looking at that. It has to have UVA and UVB protection. And also, we want to make sure that your sunscreen has antioxidants included in it. This antioxidation thing that's going on in the skin is really important. So sun causes oxidative damage. What we can do is eat antioxidants and put antioxidants on the skin. So the sunscreens can include it, your skincare can include it, and we can talk a little bit about that. So the skincare line that we carry is Epionce, and they have 2 sunscreens that you can wear on a daily basis. The first one that's really our favorite that we all love here in the office, we all wear it pretty much just as makeup, is the Daily Tinted Sunscreen. So it is 50 SPF. It has UVA and UVB protection. And then it also includes the antioxidants that we talked about. So not only is it protecting your skin from the sun, but it's also repairing damage as you're wearing it. The other reason that we really like Epionce skincare line is that it's pretty clean. So I'm a naturopathic doctor. I don't like to recommend that we're putting things on our skin, which is our largest organ, that have a lot of chemicals in it. And Epionce really is it's a pretty clean line. So there's no parabens, there's no PAVA, sulfate, and they are cruelty-free products. And that one is tinted. So it's not going to work for absolutely everybody, but I'd say for 90% of the patients that come into our office, this does blend well with their skin. The other one that's an option is the Ultra Shield SPF 50. It's not tinted. The men tend to like that one a little bit better. Or if you need a little bit more coverage, you can use that one underneath your makeup. It does have antioxidants as well. It's UVA and UVB protection, and it is water resistant. So that one's good for like our hikers around here. They like to wear that one. So what can you do if you already have sun damage, which I said is the most common. I'd say the most common people see Elaine, our medical esthetician, is sun damage. So one, definitely start protecting now. If you're not on a sunscreen, get on a sunscreen. You can come into the office and we can give you a sample of the tinted daily sunscreen or just the Ultra Shield. So you can try it out before you buy it. And also wearing a hat if you're going to be out for prolonged periods. If you're a hiker or a biker, or you just like to spend a lot of time out in your garden, make sure you're wearing a wide brimmed hat. So as far as treatment goes, really the gold standard treatment is IPL photofacial. It is a laser treatment, so it stands for intense pulse light, and it actually will target dark areas and pigmented areas and draw them out. So what'll happen is, it's a series typically of three to four treatments, depending on how dark your sun damage is. And that pigment will actually come to the surface of the skin and flake off. It's kind of a cool process. So it looks like they call it coffee grounds, and you'll notice, typically we get a lot of sun damage along the cheekbones, and so you'll just have a little bit of dark coffee ground appearance, and then that'll flake off over time, and those spots will get lighter and lighter. It is a series. You've taken a lot of years to accumulate the sun damage. It's going to take a little while to get rid of it. And you do need to wear sunscreen when you're doing this treatment. And afterwards, you want to protect your investment. And this treatment actually can be done anywhere on the body. I've had it done on my hands, where I actually see more sun damage than I have on my face, starting to get some of those brown spots. So I like that treatment. I'm going to do a few more of those. Here's just a couple of before and afters with IPL photofacial. So you can see over on the left, she had some quite a bit darker spots, and then those lightened out, and you can see she's got a more even skin tone. The person on the right definitely got a lot of benefit from that, more even skin tone. You can see even the redness has decreased in her skin, which helps, IPL can help with that as well. Then we move on to peels, which are another way to treat hyperpigmentation and signs of aging. So, peels are great for this. We have several layers of peels, several levels of peels. I would say, the light peel refresh is great, but it's not really going to help your pigmentation or your sun damage as much. If you can't tolerate any downtime, or you don't want anybody to know, that you're getting treatments, the light peel over time will help take care of those. But it's really not the most effective way to get rid of those sun damaged spots. We have the Sally Mally peel, which is kind of our mid-grade peel. That one helps a little more, but both of these are looking at many, many treatments to get rid of those spots. So I'd say laser is number one. These peels are okay for treating that, but the most effective peel that we have would be the VIPL Precision Plus. This is specifically targeting aging skin, hyperpigmentation, and sun damage. And we see benefit with a lot of other skin issues as well. So it will help lighten up those spots that you have, but it will also help your skin tone and texture, smooth out any redness. It's actually one of my favorite overall treatments for skin rejuvenation. If you have not had a peel, you definitely should be peeling. And here's a couple of before and afters for the VIPL. And you can see, like the woman on the top has a lot of sun damage, and she only had 3 VIPLs done. So we recommend, I would say 3 to 6, depending on how much sun damage you have. The nice thing about it is that VIPL can be done on any skin type. We can customize your treatment. So if we're working on pigmentation, there's one for that. If you need some collagen stimulation and you just have some wrinkling that you want to get rid of, we have the VIPL Advanced is great for that. We have one specifically for acne. So this line really is what I would consider top of the line peels for a wide variety of skin conditions. It is a little bit intense. You are going to probably sheet peel for a few days. So we like to have patients come in on a Wednesday or a Thursday and get that done. But now, this is COVID times right now. We're in 2021 and a lot of people are still wearing masks. So that really can cover up a lot of that peeling as well. But I can't recommend this peel highly enough for a wide variety of skin conditions. And then, combination therapies are always what's going to give you the best results. So one of our favorite treatments is to add a light peel to your IPL. It actually goes a little bit deeper It bumps up your IPL treatment and makes the peel more effective when you do them in combination with each other. So a lot of patients are doing that. You can actually do that on your face or your hands. And that's just a small upcharge to add a peel on for a lot of benefit. We can do alternating peels, deeper peels and laser treatments. So you can do VI peels and IPL kind of alternating, and that gives wonderful results as well. And then, of course, good sunscreen. Good skincare. You always want to make sure that you are wearing your sunscreen before, during, and after treatment. You want to protect your investment. But we also have a melanolite combo treatment that will help with your pigmentation changes at home. So, supporting yourself at home, making sure you still get that cell turnover with a serum that has a lot of antioxidants in it, the melanolite TX that will help with the cell turnover, along with your laser or your peel series is going to be most effective. Patients want as greater results as they can get as fast as they can. And so that means adding in combo treatments wherever possible. All right, so I wanted to leave a little bit of time for questions. And if you have any, you can definitely type those in the chat box. And while we're waiting for any questions to come in, I'll just go over our special for the month. We are having 20% off any of our VI Peel series, and that'll be valid with Dr. Walls. She's our new naturopathic doctor on staff, and that'll be valid through the end of April 2021. And just a little about Dr. Walls. She's a naturopathic doctor as well, licensed here in Arizona, and she focuses on chronic conditions. She really feels passionate about treating patients that have, chronic gastrointestinal problems, maybe food allergies or difficulties with digestion. She does a lot of work with autoimmune patients and thyroid, and then just chronic illness in general. So she also runs our IV department, and she's super knowledgeable about all kinds of conditions and treatment modalities, and our patients are loving her already. I don't see any questions coming in, so I'm going to go ahead and just skip on to the last page as our contact info. If you have any questions or would like to schedule a free 15-minute consultation, either with myself, with Elaine, who is our medical esthetician, and she does all of our laser therapies, or Dr. Walls, if you have some health issues that you need addressed, you can give the office a call at 928-277-714. Check out our website, prescottbotox.com, or shoot us a text. We're available and we love what we do. All right, we did have one question come in, the cost of a VI peel. So normally it's $375 per peel, and those are on sale right now with Dr. Walls, and they're $300. So that'll be through the end of April if you want to get that booked. But it is well worth it. We offer packages as well, so definitely worth the investment on that one. We've all done that peel here at the office, so if you have any questions about what it feels like or looks like, we can certainly answer that as well. We have a lot of info on our social media pages about the peel. You can watch or look at our before and afters. But yeah, it's one of the top rated procedures, I would say, as far as peels go. Thank you for that question. All right, I'm going to stay on for just a few more minutes and see if there's any other questions that come in. If not, we thank you so much for joining us today. We really are passionate about skin and treating all of these conditions that are very common. So if you ever have any questions, just give us a call.